say that this session is supposed to be focused on prevention, and I've been asked to talk about two topics. One, where we are in the World Trade Center related issues so far as asbestos-related disease is concerned, and the other is what's been going on in Libby, Montana. But if we're talking about prevention, these are negative examples, because these are situations where prevention could have occurred, but in fact didn't occur. And we're seeing the health consequences in both of those settings of the failure to prevent exposure to asbestos, and I think it's worth talking about that for just a moment. Let me talk first, and I will speak fast because we're trying to make up some time, about what we're seeing in the World Trade Center responders and other populations affected by the events of 9/11, 2001. You know, we're only 8 years from the time that thousands of rescue and recovery workers, employees in Lower Manhattan, residents in Lower Manhattan began their exposure to the asbestos that was present in the dust that was created by the collapse of the Twin Towers. It's too soon to see whether the scarring lung diseases, the cancers that can arise from exposure to asbestos are going to occur in these populations. I'm sure people in this room know that there's a latency period from the time exposure begins to the time you see these diseases. It's at the minimum generally of 15 years and more often 25, 30, and 35 years. So it is not time yet to be able to answer the question of whether these populations that were exposed to asbestos, and we know that there was asbestos present in the dust in the air, we know it was present in settled dust, in offices, on the streets, and in residential settings, but it's too soon to know whether these populations are going to suffer asbestos-related diseases. We have reason for concern. Now, the responders, those people who did rescue and recovery work down there at Ground Zero and nearby, had the highest exposure or dose. And especially those workers who cleaned up the office and residential spaces after 9/11 for weeks and months, even years, without respiratory protection and working in enclosed spaces where there's no opportunity for this material to be dispersed by wind currents, etc. No one warned these mainly immigrant populations that they were at risk for exposure to asbestos and the health consequences. Nobody monitored to see what was in the air that they breathed. No one instructed them on how to use respiratory protection, and no one offered them respiratory protection during the time that they did their work. So we have plenty of reason to worry about them. They're probably the highest exposed populations, but there was a broad range of rescue and recovery workers who were exposed during the several days immediately after the collapse of the towers and in the months that followed. Now, monitoring of rescue and recovery workers continues. We've now seen well over 27,000 responders in the programs that we've set up at Mount Sinai. And there's an effort now in Washington, D.C. to secure funding to follow these people over the next several decades, so that cancers that might develop as a consequence of these exposures can be detected early enough to be able to institute effective treatment. So we're in a process of what's called secondary prevention. We didn't prevent the exposures. Among those responders, those rescue and recovery workers, there was too infrequent use of respiratory protection. There are a number of reasons for that we don't have time to talk about. But clearly, we are not doing this monitoring to develop statistics on what the outcomes are of such exposures. We are doing this monitoring because we want to detect diseases at a time when you can do something about it. I'll just mention one other topic in relation to the World Trade Center. Since we don't know what's going to happen with regard to asbestos-related diseases, it's probably worth focusing just for a second on what were the health consequences that we were able to observe. And overwhelmingly what we saw were the consequences of respiratory burns of the upper airways, the sinuses, the nose, as well as the lower airways, the airways in the chest, as a result of inhaling the dust that resulted from the collapse of the towers. This dust contained high concentrations of pulverized concrete. And when this material is inhaled and deposited in the airways, the moisture in the airways dissolves this material, resulting in a highly caustic solution. And for those of you who remember your high school or college chemistry, the pH, which is a measure of acidity versus alkalinity, pH of this material was around 11. essentially equivalent to what you see in lye. So these people who were down there exposed to that dust were inhaling material that caused very severe respiratory burns, right? And we're seeing the consequences of that. Now, we've examined, as I said, well over 27,000 people, a number of whom, a large proportion of whom have undergone repeat examinations now. And we recently published a study that looked at what's the consequence of, in longer term, of that initial exposure. What we found is that and generally the interval between first exam and second exam was about 3 years, and what we found was most people are in fact improving. The number of people that had abnormal pulmonary function tests during the first exam is about 20%, it's down to about 16%. But more significantly, most of our patients feel better. Their breathing tests are somewhat better, but the fact is that we see very, very few people in this responder population who are back to what they were on September 10th, 2001. I'm talking about the way they feel, their exercise tolerance, and what we see in their breathing functions when we have pre-9/11 data. There's reason for some encouragement because people are in general improving, but we still have great concerns about what the longer-term consequences are going to be. And we're kind of on hold with regard to the issue of asbestos-related disease in this population, but clearly ongoing monitoring, again, to detect disease at a time when you might be able to do something about it is the key. Now let me just talk just for a couple minutes about asbestos-related disease in Libby, Montana. This story, as was mentioned, it was broken by Andy Schneider, who's going to be our keynote speaker. W.R. Grace, a huge construction materials manufacturing company, operated a mine outside of town and a processing plant right in town to produce vermiculite, mainly for insulation purposes, for soil conditioning, and a number of other applications. Now this vermiculite was heavily contaminated with a number of forms of asbestos, tremolite among them. And W.R. Grace was well aware of it when they bought the mine, and all the time that they operated the mine with the processing plant, they knew that this material coming out of the mines contained a lot of asbestos, sometimes as much as 20% asbestos in some of these deposits. They said nothing to the workers who worked in their mines and processing plants, and said nothing to the community about the fact that this material contained asbestos. The whole town was dusted for decades. The mine workers, the processing plant workers, and the community residents, including children, had very significant exposures. Very high rates of asbestos-related scarring lung disease, lung cancer, and mesothelioma have been found in that community of about 10,000 people. And in fact, the highest death rates from asbestosis in the country are found in Lincoln County, where Libby is located. Now currently, as you probably know, there's a criminal trial underway in which the W.R. Grace executives who ran the mine and plant have been indicted for violating the Clean Air Act. Not for causing the death of hundreds of people in Libby, and by the way, that number of 200 deaths is probably a real underestimate. We're probably talking about something well over 700, 800 deaths due to asbestos-related diseases. Not for causing all those deaths, not for giving the waste products of this mine laced with asbestos to the high school to build the running track, right? Not for giving it to the town to build, produce bedding for the playgrounds that children would use in town. And what they managed to do, the very clever and high-paid lawyers for W.R. Grace, have managed to contain this legal indictment to the issue of whether they released too much of a hazardous material in violation of the Clean Air Act. This doesn't seem like real justice to me. The issue of whether manslaughter would be a more appropriate charge, I think, is a reasonable one. Right? We are stuck with the situation that we're in right now, and some important information is going to come out in the course of this trial. Now, there are some distinctive features of the asbestos-related disease in Libby that's worth talking about. First of all, the disease progresses much more rapidly than is seen in workers and other populations exposed to more commonly encountered forms of asbestos. Within 3 to 4 years, and I've looked at these CT scans with Brad Black and others, Within 3 to 4 years, the scarring of the lining of the lung, which is where this fiber type really seems to attack most vigorously, can go from a very thin layer of scar that you can see on the CT scan to very thick, extensive scarring that markedly impairs lung function. Now, I've been following construction workers for over 30 years at Mount Sinai, and I've seen hundreds, probably thousands of workers. And we do follow a number of populations there year after year with monitoring exams. And I have seen in all those years, among all those workers, less than a handful of people who show rapid progression of the sort that we're seeing in Libby, which is a very common phenomenon in Libby. So something different is occurring there as a consequence of exposure to that particular fiber mix. The other thing that we see very dramatically in Libby is even when the scarring is not very prominent and demonstrable on CT scans or X-rays, there is marked impairment of lung function with loss of exercise tolerance, and we can measure this with pulmonary function testing. And that's also not a feature we see among workers who are exposed to asbestos of the more commonly exploited types commercially. There's another clinical feature of the disease in Libby that's distinctive, and that is there's a lot of asthma-like airway problems, which is not a feature of asbestos-related disease in working populations exposed to the amphibols and serpentines, chrysotile, used commercially. We've seen lots of asthma in the Libby populations, and that's something that is really different from the usual. The other thing that's pretty distinctive in Libby, it's not the first time this issue has been raised, but in Libby it's quite clear that there's something going on, and that is there's an effect on the immune system. With increased levels of antibodies to the body's own tissues, what are known as autoantibodies, where the immune system is essentially finding ways to attack the body's own tissues, especially DNA. And what appears to be a higher background rate of rheumatoid arthritis, a disease that's caused by an autoimmune phenomenon. And there have been excellent studies that point to this problem, and again, many asbestos-exposed populations have been evaluated for possible immune effects, but nothing has been quite so distinctive and well demonstrated as what we're seeing in Libby. Now, the staff of the CARD clinic, Gene Fowl of Idaho State University, Curtis Noonan of the University of Montana, and we at Mount Sinai have recently submitted a research proposal to study these distinctive features of the disease in Libby. We'd like to be able to show with good scientific studies what are now strong clinical impressions drawn from the cumulative experience of Brad Black and the other physicians who are taking care of the people in Libby with asbestos-related disease. Why is it so important to look at these distinctive features of what's going on in Libby? Because often it's in the investigation of differences in disease behavior that the underlying mechanisms of disease can be made clearer. And Libby, Montana is a site where we may learn a great deal about how asbestos causes scarring and how it causes cancer. And I don't know if it comes as a big surprise to you, but we know very little about the mechanisms of how these disease outcomes result from exposure. So we can develop, the point of doing this kind of investigation, understanding the mechanisms of how asbestos causes disease, is so we can develop interventions that can prevent disease secondarily even after exposure has occurred. So they're my remarks today about what's going on in the World Trade Center and in Libby, Montana.